Two different homeostatic imbalances that are associated with the female reproductive tract include what are called ectopic pregnancies. And ectopic pregnancies occur in about 2% of pregnancies. In this case, the oocyte is fertilized in the peritoneal cavity or the distal uterine tube and begins developing there. However, since an ectopic pregnancy cannot be sustained, it naturally aborts and there is substantial bleeding. So on the left-hand side of this slide, you can see an ectopic pregnancy, which is shown in this region. This would be pretty much closer to the isthmus than the ampulla. The ampulla is the region where fertilization should occur. So here we can see a fertilized egg developing then outside of the uterus. So not only is it fertilized, but it develops in that area. It should be fertilized in the uterine tube, in the ampulla, but then it should continue into the uterus where it's going to develop for implantation, which will be the topic of the next chapter. Another homeostatic disorder is what's called pelvic inflammatory disease. It's a spread of infection from the reproductive tract to the peritoneal cavity. It may cause scarring and lead to infertility. So you can see on the left-hand side of this image, there's a healthy female reproductive system here. On the right side, though, this reproductive system has PID, or pelvic inflammatory disease. There is an abscess that's in the uterine tube, probably more in the isthmus region. There's some irregularity surrounding the ovary, and there's also pus that's found in the majority of the uterus and also the vaginal canal. So the uterus is a hollow, thick, muscular organ, and its job is to receive, retain, and then nourish the fertilized ovum. So it plays a lot of roles. So the regions of the uterus first include the body, the main part of the uterus. That's the major portion. The fundus is the superior region, just like you've learned of other organs that had a fundus. The isthmus is the narrowed inferior region. So notice that the isthmus of the uterus is right here, but there's also an isthmus of the uterine tube, which is kind of the distal end of it. So be aware that there are two different isthmuses. Then there is the cervix, which is the narrow neck of the uterus, this region here. This is the region that's going to dilate during the labor process. So the cervical canal has two different openings. The opening that is closest to the uterus is called the internal os, which we can see right here. Then the external os is the external opening that faces the vagina. So the uterine wall is going to include three main layers. The innermost layer is the mucosal lining, and this is what is going to change due to hormone release. So there's simple columnar epithelial cells. The fertilized egg burrows into the endometrium, and it resides there throughout its 9 months time period of gestation. So we'll be seeing the endometrium on our next slide. The middle layer is the myometrium, which is what's going to respond to oxytocin. And then the outermost layer is a serous layer called the perimetrium. So the innermost lining of the uterine wall is the endometrium, and it can be subdivided into two different layers. Really the most important layer that we're going to talk about is the functional layer, called the stratum functionalis, and it responds to estrogen and progesterone. So the goal here is that after menstruation happens, that the functional layer will regrow to develop an eventual home for that zygote, which will become a blastocyst by that point. So the functional layer is the layer that is going to shed monthly. So the bottom layer under that, under the functional layer, is the basal layer, and it's unresponsive to ovarian hormones. It will form a new stratum functionalis, kind of like how you learned in the skin chapter that the stratum basalis of the epidermis would form new superficial layers of the epidermis. It might do something like that. So the next layer then is that myometrium, which remember is responsive to the oxytocin. The next slide is the vagina, and the vagina is a thin-walled tube. It does run, the urethra runs parallel to the vagina, but it's anterior to it. It extends from the between the bladder and the rectum, from the cervix to the exterior, and it's longer posteriorly than anteriorly. So it plays several different roles. It functions as a birth canal if it's not a C-section. So the cesarean section would be the opposite of that. But if it's a natural birth, the vagina does play a role. It's also the passageway for menstrual flow and the organ of copulation. The layers of the vaginal wall are the inner lining would be the stratified squamous mucosa with rugae. And the reason it's this is when there's friction from intercourse, those stratified squamous cells are going to be destroyed. So the deeper layers can replace those layers that were destroyed. The middle layer is the smooth muscle muscularis. And then the third layer is this adventitia. So one of the characteristics of the vagina is that the vaginal secretions are acidic in adult females, but alkaline in adolescents. So this acidity is to help protect the vagina. The mucosa near the orifice forms an incomplete partition called the hymen, which ruptures during intercourse. There are situations where some young ladies have to have their hymen surgically pierced so that intercourse can actually occur. And then the next slide is on the mammary glands. The mammary glands are modified sweat glands. They're actually exocrine glands, and the areola is the pigmented skin that surrounds the nipple. The lobules within lobes contain glandular alveoli that produce milk. So the milk passes into the lactiferous ducts first, then into the lactiferous sinuses, which then open into the nipple. So you should know those structures in order. In non-nursing women, the glandular structure is undeveloped, which makes sense. So lactation is going to be promoted by prolactin and oxytocin. So both of those promote or control lactation.